The link between obesity and cancer is no longer in question. What remains in doubt is whether society has the political will to confront it. As cancer rates tied to obesity continue to rise, especially among younger adults and disadvantaged communities, policy solutions are no longer optional. They're essential. But most proposed interventions, while scientifically sound, face fierce resistance from industry lobbyists, political inertia, and a culture deeply conditioned to view health as a matter of personal responsibility rather than systemic design. Let's be clear. This crisis cannot be solved through willpower or individual lifestyle changes alone. The environment in which people live, work, and eat must be reshaped. And that starts with policy. Soda taxes are one of the most researched and controversial solutions. By raising the price of sugar-sweetened beverages, among the biggest contributors to excess caloric intake, governments can reduce consumption, especially among youth. Cities like Berkeley and Philadelphia have already demonstrated modest declines in soda sales and increased revenue for community health programs. Yet soda taxes are routinely blocked or repealed under pressure from the beverage industry, which frames them as unfair to the poor, even though low-income communities are the ones who stand to benefit the most from reduced chronic disease rates. Subsidizing healthy foods is another critical step. Currently, U.S. agricultural policy pours billions into corn, soy, and wheat, ingredients that dominate ultra-processed foods, while offering little support for fresh fruits, vegetables, legumes, or whole grains. Rebalancing subsidies would make nutritious foods more affordable and available, especially in food deserts where fast food is the only accessible option. But again, entrenched interests in industrial agriculture make reform politically toxic. Improved food access must go hand in hand with zoning reform and retail investment. Many low-income urban and rural neighborhoods lack full-service grocery stores, while being saturated with fast food and convenience stores selling calorie-dense, nutrient-poor products. Incentivizing supermarkets to locate in these areas, improving public transportation to food hubs, and expanding programs like Double Up Food Bucks for SNAP recipients could significantly reduce diet-related disease. Community fitness programs also have a role to play, but they must go beyond token efforts like building walking trails or offering occasional exercise classes. These programs need sustained funding, integration into schools and workplaces, and cultural tailoring that reflects the needs of the populations they serve. In many cases, people aren't inactive because they're lazy. They're overworked, under-resourced, and live in neighborhoods where outdoor exercise isn't safe. School nutrition standards are another key battleground. Rolling back processed food and sugary drink offerings in public schools is a no-brainer. Yet even this has been met with lawsuits and lobbying from food manufacturers who supply lunchroom-friendly junk. Feeding children healthier meals is not a luxury. It's cancer prevention in its earliest and most effective form. There's also the question of labeling. Mandatory front-of-package warning labels, like those used in Chile and Mexico, can quickly educate consumers on the dangers of excess sugar, salt, and fat. But in the U.S., food companies have successfully lobbied to keep nutrition labels small, confusing, and placed on the back of packages. Clear warnings are resisted not because they're ineffective, but because they work. Healthcare policy must also adapt. Physicians should be reimbursed for obesity counseling and nutritional education, just as they are for prescribing drugs. Cancer screenings should be expanded for high-risk obese populations, with special outreach to marginalized groups who are too often missed. And medical training should include far more emphasis on nutrition and prevention, not just surgical and pharmaceutical intervention. But even the best policies will fail if they're not backed by funding, enforcement, and a shift in public attitudes. As long as obesity is framed as a personal flaw rather than a consequence of social and economic engineering, the root causes will remain untouched. And the industries profiting from obesity, food, beverage, advertising, and even parts of the healthcare sector, will continue to undermine public health at every turn. The warning is real. We are sleepwalking into a future where cancer is the inevitable price of modern life. Only sweeping policy reform can change that trajectory. This means taxing what kills us, subsidizing what sustains us, educating what has been misled, and protecting those who have been most exposed. Anything less is not a solution. It's complicity.